I'm Melissa, and today I'm going to show you how to use your exercise ball to strengthen your thighs and your back all at the same time. If you like this and you want some more, go to my YouTube channel and click subscribe. You guys know I love using exercise balls. They are great. They are very versatile. It's inexpensive exercise equipment. You can use it at the gym, you can use it at home. It helps to activate receptors all over your body, you strengthen your core, and you can do so much on it. It takes away things being monotonous, or if you hit a plateau, use an exercise ball because it'll add a challenge to your very simple exercise. Even if it was something simple like a bicep curl, you sit on this and then you have a challenge. So it's great. It's using a TheraBand Pro, the SPC series. And the reason for that is I like the texture. I also love the fact that it is a double bladder. So what that means is if you were to allow this precious piece of equipment to roll over a tack, pin, whatever, and it were to pop the ball, it would slowly deflate. So if you were on this and say you rolled over a tack or something, it would slowly deflate. It wouldn't burst like a balloon. So using the exercise ball, you have to make sure you use the right size. So I'll include the link from my previous video on how to choose an exercise ball for your size. So once you've got that going, then all you need is yourself, possibly a mat if you need that just for some extra support, and an exercise ball. Okay, what's really cool about this exercise is that it makes up for using the machine at the gym. You know the one where you sit down and then you bring your legs together? There's the opposite one where you pull your legs apart. Well, this one is the one where you're going to squeeze your legs together. Now, one thing you have to be careful when using exercise machines is that if you cheat, sometimes when you're holding on to the bars that are attached to the machine to give you extra support, that's great, but you may end up using one side more than the other, and you might have a muscular imbalance, which isn't really fun and kind of defeats the whole purpose of trying to work out and strengthen, right? So with an exercise ball, it kind of catches you on cheating per se. And so your body can't cheat, and you can kind of tell whether you're targeting or you're not targeting. So you can be seated on the ground and you can just be kind of freestanding, or you can, if you need extra support, you can just sit against the wall with your back nice and tall and your butt right up against where the wall and the ground meet. You are seated on the ground, you're going to have your legs wide apart that you can bring the exercise ball between your legs. You're going to have your knees bent and that your feet can be planted on the ground or it can be out to the side, whichever is comfortable. It's not set in stone. It just has to be that you can get that set up, okay? As you can see, I have my arm back like a tripod in a way, so I can just support myself and hold myself up, okay? Just because you have to have a little bit of an incline. Now, you're gonna want your other hand on the top of the exercise ball, because in my head, for some other reason, I feel like this ball, the second I squeeze it, it's gonna go flying. So it's always good to, you know, stabilize and make sure the equipment you're using doesn't go flying away from you. So now that we have, we've got our kind of a tripod position, we have our legs wide apart so we can fit the ball in. You also want to get it up there, just close enough to your groin so that way you're actually going to feel the exercise activate. You're going to focus now on this spot here on your inner thigh on both sides, okay? So this spot here, just right above the knee, but on the inside of the thigh, that's where you want to focus on both sides to squeeze the exercise ball. Now, we're going to target and isolate, so it's a little different. We don't want to go like this, okay? That's not going to do anything. It's kind of sloppy, all right? What you want to do is you want to squeeze the ball, and then you're going to slightly let go just a hair, all right? Then you're going to squeeze again, and you're going to let go a hair. Now, one rep is when you squeeze in, let go just a hair. That's one rep, okay? So the thing is, when you're doing this, it's more of a pulsing kind of motion. And if you're doing this properly, you should feel that your inner groin is activating, it's cramping, it's sore, and that means we're targeting and isolating. So I tell patients, think of yourself as like, you know, a ninja. You're doing this so subtly, no one can even tell that you are doing it. So it should just look like, oh, what's she doing? Just sitting there? Yep. But in reality, you're actually kind of, you know, dying from this. So, but yeah. So you're just going to do this pulsing motion, and if you don't feel it, then you need to readjust, reset yourself so that way you can feel that. If you don't feel it, again, readjust, change your positioning, maybe try sitting against the wall, see if that works better. But so again, you're going to have the legs wide, you're going to make a tripod position, right, with the contacts there. You're going to put the ball right there, hold here, and then squeeze. Whew, yeah, I feel that. You also want to make sure that your back stays nice and tall when you do this too, okay? So if you can't do that, then again, sit against the wall. All right, and yeah, so, oh, that's a good one. Doing this exercise, you're gonna notice that it will be easier for you to stand taller. Your feet are actually gonna point straight ahead. So when your inner thighs are weak, your feet will point outwards to the side. You may have low back pain, but when you do this exercise, you'll notice that your feet, your inner thighs will activate, and your feet will actually point straight ahead. And you'll notice that your back pain may have settled down a little bit. I'm not saying it fixes it, but we want to strengthen the muscle groups that are responsible for kind of controlling that pelvis in a way, okay? So on the note, until next time, I will see you later. Bye guys.